Hello, welcome to All Around Health Talk. Well, if you haven't subscribed to our channel, you know what to do. Hit the subscribe button, put on your notification so you get notification for every time we post a video. Well, we're still on our tips series where we give you tips on how to manage your health. Today we're talking about controlling your blood pressure as a hypertensive patient. Now, if you suffer from high blood pressure, you know that it means that your blood pressure is higher than the normal value. You're probably on medication or lifestyle changes by now. Now, why should you control your blood pressure? As a hypertensive patient, it's important for you to control your blood pressure because if you do not control your blood pressure, you stand a chance of suffering from heart attack, a stroke, kidney diseases, kidney failure, eye diseases, generally multi-organ diseases or problems. So it's very important for you to control your blood pressure. Now, how can you control your blood pressure? Number one way to control your blood pressure is to make sure that you take your medications. Now, if you're hypertensive, you're definitely on one type of medication or the other to control your blood pressure. It's important for you to take your medications every day. Some people take medications twice a day, some people take once a day. Whatever be your case, make sure you take your blood pressure medications every day. Number two, make sure that you pay attention to your blood pressure medications. Why? Because you cannot avoid taking your medication. It's very risky for you to go a day or two or three without taking your medication. So what do I mean by watching your medication? It means that you have to control your medications and realize when you have 10 pills left, you have to try and get more. Don't wait for your pills to finish, then you realize that you need to get more, because what if you do not get more? Then you go a day or two without taking your medication, and that is risky. So make sure you control your medication so that when it's left with 5 pills, you go to the pharmacy and you get your pills. Now, what else should you do to control your blood pressure? Take your blood pressure or measure your blood pressure on a daily basis. If you have an automatic blood pressure machine, then try to do that every day. At least take your blood pressure before you take your medications, and after you take your medications, take your blood pressure in the morning and in the evening. If you do not have the automatic machine, then try to go to a clinic near you to take your blood pressure on a regular basis, just to know where you stand. Why? Because sometimes your body gets so used to the medication and it's no longer working for you, so your blood pressure is not being controlled by that medication. Now, if you control your blood pressure on a daily basis, on a regular basis, you take your blood pressure, you would know when there is no change. Maybe after your medication, before and after your medication, the blood pressure remains the same or it's even going higher. You know there is a problem and you go to your doctor and they check you up and decide if you need to increase the dosage of that medication or if you need to be on a new medication. So it's very important to take your blood pressure on a regular basis. What other things should you do? Lifestyle changes, like lose weight. Obesity or overweight doesn't go with high blood pressure. It's a very bad combination. So make sure you know your body mass index and try to lose weight in accordance to your body mass index. Now, what else should you do? Exercise. I don't mean going to the gym and lifting all the weights in the world. No, you can take a walk 30 minutes every day for 5 days a week. That is good exercise for your heart and for your body, and to help you burn calories. What else should you do? Reduce your sodium content. Salt content in food has to go down. Okay, so make sure that you're using little salt quantity to cook, and make sure that every other condiment that has high sodium content is also reduced in your diet. What else should you do? Avoid eating out. Right? You can eat out in very good restaurants, but what I mean by eating out is mainly eating like this canned food, fast food outside. Avoid doing that because that's just going to make you increase weight. Increasing weight with high blood pressure doesn't work. So what else should you do in terms of your health when you're hypertensive? If you're a smoker, stop smoking. You have to quit now because it doesn't work well for your lungs or even for your heart. So make sure that you do that. And if you take alcohol, then you want to reduce your alcohol quantity. Okay, make sure that if you're taking beer and whatever alcohol you're taking, reduce the quantity, because those things don't help your blood pressure in any way. Now, on a on a general note, you need to just eat healthy, more vegetables, balanced diet, and a very good lifestyle, controlling your blood pressure every day, taking your medications, and you'll be fine as a hypertensive patient. If you like the tips we've shared today, then you know what to do. Hit the subscribe button, put on your notification, and also follow us, share our videos, and leave us a comment. We'll see you in the next one. Bye.